And we're back on Second Street. Talk about a couple private companies that are emerging in Canada that are helping patients access care. And I'm chatting with Dr. Ramond Rupert. He's the founder of a company called Healtheon. For the break, Dr. Rupert, we were talking about sort of some of the services that you provided. One of the ones that I find interesting is sort of this option of getting a second opinion from someone through your service. Could you tell us a little bit about how that might work?
Yeah, so what we do in Healtheon is we have a monthly subscription. And one of those subscriptions allows the individual to access a special specialist for a virtual case review. RCM Health, which is a partner company with Healtheon, has over 4,000 specialists globally. So it's a global ecosystem that patients can access. And the way it works is if the individual has purchased a Healtheon plan and they develop a heart attack, stroke, or cancer, then they can access the service through the Healtheon patient portal. RCM Health then takes over and does an intake and interview, accesses their data and their imaging, and then we select an expert who provides a review. The expert does not talk to the patient. That's inappropriate. But they review all the data. They can talk to the family doctor with the patient's permission. And then within 2 weeks, there's a virtual case review that the patient can access and can be very, very helpful.
I find it fascinating how this option is there that I'm guessing a lot of patients wouldn't have had, say, 30 years ago, where you couldn't simply send your medical records to some expert somewhere else in the world that you probably had no idea even existed. So it's fascinating that that option is there. I want to ask you about the public policy element, but just quickly, are there any patient stories that stand out in your mind that you've been able to help over the past few years?
Yeah, so RCM Health has been providing specialist case reviews for 30 years. And so we've got a lot of understanding of how the world works, especially in complexity. So we had a 26-year-old patient, young lady in Ottawa, who developed a very rare brain tumor called a pineal blastoma. And there was no treatment for her in Canada. But there is treatment in the US called proton beam, which is a type of radiotherapy. And so the father drove the family to Houston, signed up at MD Anderson, and wrote a check for $300,000. And RCM Health appealed to the government, to the out-of-country funding office, and we were able to source the funding, the $300,000 for her treatment in Houston. And she was treated and did well and is back in Canada.
Wow. I'm sure that family appreciated not having such a large bill to have to handle.
Well, I was, exactly. I was a rock star in Barrie for a couple of weeks after this happened.
Well, that's great to hear. I want to shift gears and ask you about the public policy element in this. You've been in healthcare for a long time. You've been in this this role where you're helping patients, sort of more so on the private side. Are there any public policy barriers or policies that you think need to change to be able to better help patients? And what are those, and what do you think needs to happen?
Yeah, so Healtheon recognizes that, our job, our mission is to improve public sector primary care. And so we're giving patients the option of some tweaks. The system is public. We're not challenging that in any way. And in fact, we're attempting to partner with government. So we're running a sort of an educational program with ministries of health to make them fully aware of what we're doing. We don't want anyone to be surprised. And we're finding that there's a good receptivity because patients want help with their administrative journey. We don't want doctors to burn out, so team-based care supports that. And we think we can lighten the load on the specialists, the demand for specialists, by providing the second opinion case review. So I think we're really working in concert with the public sector primary care system.
Okay. Well, that's interesting that largely the government seems to be receptive of sort of this alternative approach to helping patients. Thank you for taking a few minutes to chat today. Where can people learn more about Healtheon?
The website healtheon.ca is fully loaded. We've got an email, which is info@healtheon.ca, and we're happy to talk to folks.
Okay. Thanks for your time today.
You're welcome.